Hi, so I'm going to continue to cover some Yamuna fundamentals. Again, this would be helpful to go through before you start taking any of the initial online classes with me. So I wanted to cover a little bit more. We talked last time about, in fundamentals part one, about getting used to being on the ball, how to sink into the ball, how to move with traction on the ball. A couple more pointers or terms that you'll hear me come up with is one of the things that we don't want to do. I talked about how we're always going to move kind of slowly through the muscle and then it's okay to stay at a certain point. But what you don't want to do is roll back and forth over the same point. So, again, I think if you're like me, I look at other people around the gym and so on, and you see people on foam rollers all the time, and they're just rolling and, kind of heading back and forth. And that is not what we want to do, right? So we're always, again, like I said, we're going to be going from origin where a muscle starts to insertion. And I will let you know that for every routine, usually what specifically. Sometimes I'll get into detail about what muscle. Sometimes, particularly when we do things like get up into the shoulders and we may be working, 4 to 6 muscles all in one routine, I may not belabor it too much. But again, say we're going through the leg, once you start scooting your body back and working through the leg, we're not going to go halfway down the hamstring and then go back up. Okay. We may sometimes reverse our direction to kind of catch underneath a muscle. So for example, when we're going to do the glutes, right, we will start at sits bone, drop into the hamstring tendon, and then reverse the direction and go up so we can kind of get underneath where the glutes start and then be able to lift up from there. But again, we're not going to be, down here in the middle of the hamstring and just, going back and forth. We may, from time to time, do something called cross fibering. And what cross fibering is when I say that, you're going to know that instead of going along the muscle fibers, we're going to be going from side to side. Usually when we are doing something like that, we're often trying to get muscles kind of unstuck or not so adhered to each other. So again, keep using this simple example of the hamstrings. That is definitely something that we can do in the hamstring, right? We have 3 main muscles that we're working with back here. They all run pretty much in nice straight lines. So once we come off the tendon, instead of going down the length of the leg, right, we can shift hips to one side, going out to the most lateral hamstring. We can shift back through the middle and then shift our hip off to the side and come to the more medial hamstring. So that's cross fibering, and you will hear me refer to that from time to time as we do it. Another thing that I may ask you to do is provide traction. So when I ask you to provide traction, we're usually going to use our hands to get the ball to actually send the muscle in a specific direction. So we do a lot more muscle tractioning around the upper body. And it may be a little alarming or confusing sometimes, and I'm actually going to want you to get the ball to grip the skin. So an example would be around the neck. And for a lot of women, this is an area we're really sensitive about. And we think, oh, I don't want my skin on my neck to pull any more than it already is. But for most of us as we age, our necks start to be maybe a little less attractive because the muscle and the skin is adhering to each other, right? So the muscle fibers are starting to adhere to each other, and then they're grabbing the skin, and kind of the skin is gluing down to those. And so we're wanting to release that. So when I say traction, instead of, if we're just laying on the ball, we actually will take the hands and say, I'll turn my head a little bit more to the left and traction the ball to the right. Okay. Same thing may happen when the ball is in the armpit. I may ask you to actually push the ball with your hand to the back. And when I say traction, again, the importance is that you keep your weight down into the ball as you use the hands to pull the skin in the direction that I am guiding you to. So sometimes, again, like I said, that is to get some skin to move. Sometimes it's really to encourage the muscle kind of back into its more appropriate anatomical position, or to get it to kind of unglue itself from neighboring muscles or structures that some muscles have a tendency to glue towards. So we went through cross fibering, tractioning, we've talked about sinking, we've talked about always moving from origin to insertion, following routines, moving slowly, A couple more things you will notice at the beginning of the routine. I'm always going to give you a bony landmark to start out. We're always going to pause there. We're going to stay there for 60 seconds, sometimes 2 minutes, which sometimes can feel like an eternity. And it especially can feel like a long time when you don't feel anything in that bone. So you will notice as we go through these routines, sometimes bony landmarks can feel really sensitive, and you'll want to get off that bone as soon as possible. One example of that for most people is the pubic bone. However, you may be on some landmarks, say like these front hip points, these anterior superior iliac spines, and you may lay there and you may think, I don't really feel anything. Well, I'm still going to make you stay there because most of these bony landmarks have muscle attachments coming from all different directions, right? So we may have, sometimes 3, 4, 6 different muscles all attaching in one small area. And so we really want to stay in those places and give the body some time to unwind. So a couple other things in preparation for class, what to wear. Clothes can get really tangled. So even if you're feeling self-conscious, you will realize very quickly that wearing baggy clothing is not what you want to wear for body rolling. So you are going to do best in things that are form-fitting and stay close to the body. So I do have some people even tell me for the lower body routine. So again, shorts, not such a good idea. Leggings are probably gonna be most comfortable. Some people choose not to wear underwear, even thongs during sometimes like the gluteal and lower body routines. And the reason is as we traction up through the glutes, even then it kind of can sometimes get a hold of things and start tugging. So that is up to you. Same thing when we get through the chest. Any routines we do up the back, if you've got a shirt that is baggy, the ball is going to get tangled up into the shirt. And then the other thing is when we're doing chest routines, to be in a really constrictive sports bra definitely makes doing the routines a little bit more challenging. For those of you who have nursed children and have breast tissue that is now really willing to move, I actually encourage to be able to physically move some of your tissue out of the way so we can get to some of the underlying muscles, right? We have a lot of people, a lot of tension in the pecs and serratus and some of the muscles that are underneath the breast tissue out here to the side. So really being able to get to address that. So you may want to wear form-fitting, but again, particularly if you're in the privacy of your own home, regardless of how you feel like you look, you could do a more form-fitting top and then maybe not the most constrictive bra underneath it. So you do want to be comfortable while you're body rolling and not have to stop your routines because you're getting tangled up in your clothing. Hydration is important. So you want to look at a body rolling session the same way you would as going to get a massage. So I have had people, I think, probably have more muscle soreness afterwards from not hydrating. But again, being hydrated is always a good idea, but even a better idea when you're doing body rolling. And then I want to talk just a little bit more about ball selection. So I will always be very clear and upfront about what ball we would be recommended for certain routines. So, in general, again, gold, largest and softest. So this creates space. So even though this is kind of recommended as a beginner ball, it's not, it definitely doesn't mean that it's not advanced. So I sometimes choose this ball over all the others. And it's because of how large it is, the ability for it to create space in the neck, create space in the shoulder, create space in the hips. So it is a softer ball, but it also, that ability to create space and length can sometimes make it really, I can say, even more intense or just a different sensation. So this ball will always be used in the abdomen, most likely on the rib cage and chest, where some of those tissues can be really fragile, and through the neck. For some people, this will be their go-to ball for their lower body as well, right? The silver ball may just feel too firm and be too painful. Again, this work is not, does not need to be painful in order to be productive. So gold ball, silver ball is smaller and firmer. Again, this is going to be kind of the staple ball though for a lot of lower body routines like quads, hamstrings, and glutes. It also is part of just kind of the foundational back routine. Black ball are for small detailed work, right? We're really able to get into nooks and crannies, focus more on individual muscles, make small joint movements with the black ball. It also enables us sometimes to do both sides of the body at the same time. So example, we could roll through both hamstrings with the black balls, or we can do fine detailed work that we just can't do with some of the larger balls, for example, calf work or work along the anterior parts of the shins. So there is a smaller pearl or white ball too, which I haven't spoken too much about. However, if you are someone who is really petite, or also somebody who is petite with particularly with large breast implants, so sometimes implants can be hard to work around, though we can do that. As you can imagine, if you are kind of a small person and then you have a lot of breast tissue to work around, using the gold ball, it can kind of be difficult to do. So having a softer, smaller ball can be more useful in that case. But again, I will always let you know what ball I'm recommending and can kind of advise you as we roll through things what you need to do.